Welcome to the Chelsea and Westminster Hospital's NHS Trust Simulation Centre. My name is Satu and I'm the lead nurse for the clinical skills and simulation. We have two simulation centres that are based at Chelsea and Westminster Hospital and West Middlesex Hospital. Our mission is to improve the clinical performance of staff, and we offer multi-professional training emphasising the importance of human factors in managing crisis situations within the healthcare settings. Let me hand over to my teams.
Hi, my name is Jennifer Hanrahan and I am the Clinical Simulation Educator for both Chelsea and Westmid. I work cross-site at both hospitals and my role is to ensure the smooth running of all of our programmes.
Hi, I'm Tom. I'm the Simulation Technician for the Centre here at Chelsea.
Hello everyone, my name is Shmila. I'm Simulation Technician based over at the West Middlesex University Hospital site.
We deliver simulation programmes to a wide range of our staff, from doctors, nurses, midwives, healthcare assistants and physios. We use a blended approach with our education programmes, incorporating learning from COVID. We identify issues in the clinical setting and work using simulation to address these to support the needs of our clinical-based staff.
So I support the delivery of all our simulation courses. One of my main responsibilities is to look after all the equipment we have. So whether that be patient simulators, past task models, AV systems or IT equipment. So I'm just going to run through a few of them for you now. If you just take a look. So if you see there, we've got our usual sim family that most centres will have. Sim man, sim mum, sim junior and a baby. We have two simulation suites, both with our AV system installed, which is SimStation, Human Patient Simulator from CAE, and also we have our microsurgery microscopes. Also, I might do the odd patient voice or two.
Oh, what was that?
Yeah, I know you're not feeling too well, but I've called the doctors and they're coming to see you shortly, okay?
Alongside our staple simulation courses, such as our postgraduate, undergraduate and clinical speciality courses, we are continually looking at ways in which we can develop new courses and meet the needs of our evolving faculty and evolving clinical needs of the patients. This month we will be launching an embedded practitioners course to facilitate clinical-based staff coming down, getting experience on the simulation courses and gain confidence. We will be teaching them about the etiquette and the principles of simulation.
Not only do I get involved in the technical setup and supporting of the equipment we have over at Westmid, but I've also been part of the faculty who get involved in debriefing on the human factors side, and I also get involved in playing different roles throughout simulation. So with the paediatric team, I've been involved in playing different roles as parent, so as a mum, an anxious mum, a very angry mum. I've also been part of a couple who've come in who speak no English and have to communicate with clinical staff. And all these factors go into the communication side of simulation, the human factor side, which is also a big and a key part of simulation and how we try and improve our multidisciplinary teaching throughout the trust.
So one of the breakout courses that we offer here in the centre is Maternity in the London Ambulance Crew coming together, and we focus on the pre-hospital setting. So we have our community midwives, we have case-loading midwives, we invite the whole London Ambulance Crew ranging from the phone techs to the paramedics to the ambulance crew, and we bring together the equipment and technology that we use on a day-to-day basis, and it offers optimum environment for the shared learning together.
Hi, I'm Dina Shafali Patel. I'm one of the neonatal consultants and the lead for neonatal simulation here at Chelsea and Westminster. With my colleagues down in the simulation department and other colleagues up in the neonatal unit, we run a number of simulation courses and scenarios and days. These include the Stein course, which is a mandatory once-a-month course that we run for staff both at Westmid and Chelsea and Westminster from the neonatal perspective.
So here at the centre, one of our well-established courses is our multidisciplinary obstetric and midwifery simulation course, our MUMS course. This was started in 2010 and it was founded by one of our practice development midwives and an obstetric consultant. At Chelsea, we're really passionate about MDT working. We're really conscious that teams that work together should also train together as well. So that's why on this course you'll find professions from maternity support workers all the way through to our obstetric and anaesthetic consultants. We have over 400 candidates that come through the course every year, and we redevelop it and update it annually to ensure that we incorporate national data as well as national reports and also our local risk data as well.
The consultants in these areas are very involved in SIM and they're very engaging with the clinicians, and as a result they have a massive turnout for staff who are willing to come on board and learn through SIM.
We run in situ simulation. That's up on the neonatal unit, on labour ward. We involve the anaesthetic team, the midwifery team, the obstetric team. This is really to make sure that people who are working together are training together.
We are continually working on ways that we can work as an integrated care service. We practice this by working collaboratively with many other trusts. At Chelsea and Westminster Hospital, we are continually looking at ways that we can improve our service. In the next 2 to 5 years, we will be moving into a new education facility based at our West Middlesex site. We are really passionate about what we do here at the Trust, and we would love for you to come and visit us.